Hello, this is Dr. Bridget Jimenez here at Laredo Medical Center in Laredo, Texas, and I'll be giving you a brief medical report for the patient Grace Vega. Her patient ID is 36981, and she was born on July 29 of 1989. Based on her medical history, we found that she has no allergies, and she was admitted to the emergency room on April 8th of 2019 in abdominal discomfort. She expressed dissatisfaction of acute abdominal pain on the right and lower iliac region in the abdomen. She had a normal weight, her skin was pallor, and there was no presence of diaphoresis. Her heart rate and sounds was 85 beats per minute, and her lungs they were clear to osculation. We found in her abdominal pelvic cavity an acute audible peristalsis. However, in her right upper and left upper quadrant, they were tentatively quiet. Her muscles and joints were symmetry, and there was no swelling of masses disformity. Our clinical impression came out to be abdominal acute pain, and we proceeded with doing a physical exam, a blood test, and a flexible sigmoidoscopy. During the physical exam, the patient felt acute pain when tapping on the right and left lower iliac region in the abdomen, and there was presence of bloatiness on the 4 abdominal quadrants. On the blood test, it was negative, and there was no presence of high blood cells, and therefore there was no inflammation inside the body. Also, the levels of the red blood cells are normal, and there was no presence of anemia. The results of the sigmoidoscopy test demonstrated 1 minor internal hemorrhoids and severe erythema in the cecal and the sigmoidal walls. The preoperative diagnosis came out to be irritable bowel syndrome, and the procedure we continue to be the flexible sigmoidoscopy. To give a brief description of what the procedure was about, the patient will have to lay down on her left side of the examination table. The physician will insert a thin flexible tube called a sigmoidoscope into her anus. The tube has a light and a very small camera at the end. With this, we could see images, and then they were transmitting to a monitor for the physician to see. The tube will inflate the patient's colon as well with some air to make it easier to examine. And the patient was under sedation to prevent any type of discomfort. And lastly, the patient had to shift maybe a minute or so to make it more easy to use the scope. Our final diagnosis was that she had irritable bowel syndrome, the alternative type, and we discharged the patient on April the 5th of 2019 with follow-up instructions to go with Dr. Hernandez to discuss any suitable healthy diets and maybe found the food that triggers her abdominal pain. Thank you so much, doctor, and if you have any questions, please let me know. Bye-bye.